Is it risky to have a baby after 35? The risks associated with being over 35 and pregnant tend to be exaggerated. If you are in this age group and are healthy, you can generally expect to have a successful pregnancy, so try not to worry. Getting pregnant in the first place is probably the biggest obstacle you'll face. If you are aged 35 to 39, it could take you a couple of years to conceive even if you are having unprotected sex twice a week. For about 82% of women aged 35 to 39, it takes a year or less to conceive. For another 8%, it takes 1 to 2 years to conceive, leaving 10% still trying after 2 years. So, you may need to be patient. If you are over 35 and having problems conceiving, see your general practitioner as soon as you can so she can check your physical readiness for pregnancy. You may want to consider assisted conception treatments. Bear in mind that treatments such as IVF using your own eggs are less likely to be successful once you reach 35, and success rates decline even more rapidly in your early 40s. As an older mom, you are more likely to have pregnancy complications such as high blood pressure, gestational diabetes, placenta previa, preeclampsia, and premature birth. And it's sadly more common for older moms to have a miscarriage or an ectopic pregnancy. Though the rates are still low, the risk of having a baby who is stillborn doubles once you are over 35 years of age and is 5 times as likely when you are 40. Genetic or chromosomal defects are also more likely, with the risk of having a baby with a chromosomal abnormality such as Down syndrome being highest for moms over 40. However, your midwife or obstetrician will be well aware of these slightly increased risks for older moms during your antenatal appointments. She will explain the screening and diagnostic tests that are available to you, as well as advise you about how to stay healthy. Some birth complications are also more likely in older moms, though this doesn't mean that they'll automatically happen. You may be more likely to have a longer labor, perhaps because the muscles of your uterus may not work as efficiently. You are also more likely to have your labor included, have an assisted birth, or a cesarean section. Be assured that health professionals are often more vigilant when it comes to looking after old moms in the final weeks of pregnancy. Try not to be unduly worried. The chance of any of these pregnancy or labor complications happening is small, and there is a lot you can do to help yourself. Eating well, exercising regularly, not smoking, and cutting out alcohol will help you to have a healthy pregnancy. The good news is that as a woman in your 30s, it's likely that you already have a healthier lifestyle than you did in your 20s. Be assured that despite the slightly increased risks, you are still more likely to have a healthy baby than not, even if you are in your mid-40s. During this lecture, we have gone through: is it risky to have a baby after 35? During the next lecture, I'll be describing what exercises are suitable before and during pregnancy.